All right, so the N in care plans is for newborn maternity, okay? And it generally refers to our patients who are in that kind of OB maternity newborn phase. All right. The reason why it shows up on the NCLEX is not because they expect that there's going to be a percentage of us going into this field, although there will be. And those folks who go into this field, may have an advantage because they've spent more time precepting or something in this area. But we all should be aware of some of the basic emergencies that can happen in this specialty, right? Because overall, NCLEX isn't about specialties, it's about generalist medicine. But the theme that joins everything together, that brings together all of the content that you will study is the potential for a safety crisis or the potential for a threat to the patient's life or limb. Okay, so everything I focus on is generally around an emerging crisis in the patient. So with newborn maternity, we do need to know the OB complications. All right, the complications that happen during childbirth. And we're going to have a whole day for that at the very, again, I mentioned that before, at the very end of the class, we'll have um, entire 2 hours to focus on those OB maternity issues. All right, APGAR. Do you know what that is? APGAR and what it refers to? All right, what about cyanotic heart defects? They're going to be your pediatric patients who will be born with cyanotic heart defects. And on the NCLEX, they will mention these kids in particular scenarios where they might have pallor, right? They may have blue or cyanotic fingers, extremities, right? They might do the little cyanotic squat where the kids sit in a little bit of a conservative, almost fetal position, right? Do you know those defects? Do you know what they look like? Because NCLEX most certainly doesn't want you overlooking that kid when they come into the ED, because they usually need cardiorespiratory monitors and apnea monitors and possibly even resuscitative equipment if needed. Type 1 diabetes, that's a pediatric condition we want to look out for. That patient can be in DKA or other types of emergent crisis. CF or cystic fibrosis, those kids are pretty threatened with their buildup of mucus that happens in the lungs, right? So they need that chest PT to manage their care. Intussusception, Hirschsprungs, those two often are compared to one another on the NCLEX. Do you know the difference between the two? Intussusception, right, where you have the telescoping bowel, and then Hirschsprungs, where you have the blockage in the colon. Do you know which one has the red currant jelly-like stools versus the one that has the ribbon-like stools? All right, that's the kind of stuff you want to know for the pediatric topics that come up on the NCLEX. Acute nephritis, okay, Wilms tumor, epispadias, extrophy of bladder. Knowing what those terms mean will take you a long way on understanding the crises that come up. All right, APGAR. If I gave you an APGAR score of 3, would you know if that was a good score or a bad score? Do you know the range for APGAR and the components that make up the APGAR score? Well, you certainly should if you get a question like that. Now, here is our last letter in our mnemonic care plans, and it's S. I would say next to airway, signs of shock would be like super important for you to get right on the NCLEX, right? Because the NCLEX has value to each of their questions. So you might actually have a question that's worth far less than another question. And you'll find that if you don't earn enough points moving throughout this test, then you won't be able to pass all 8 sections of the NCLEX, right? Management of care, right? Pharmacological and parenteral therapies if you're RN. Everybody gets safety and infection control and health promotion and maintenance. All right, so that's just to name a few of the categories. So you have to pass all of those, right? So I'm trying with this mnemonic to share with you critical components that will thread throughout each of those 8 categories. And if you don't know the signs and symptoms of shock, you may not pass the NCLEX because it's so important, because it's seen so often in our tertiary care setting. So let's talk about the 3 types of shock that you could see on the NCLEX. All right, hypotension or hypotensive shock. All right, that could be seen in your dehydrated patients. That could be seen in your patients who are going through blood pressure or hypotensive blood pressure issues. It could be seen in it could really be seen in any kind of patient, all right, because it's just dehydration. So, do you know the vital signs? I've started this whole talk about, mentioning changes in the patient's status, specifically vital signs being unstable. All right. Well, this is a big one, hypotension. Don't miss it. All right. What is hypotension on the NCLEX? Let's go with 90s or lower. Right? It's so obvious if you had a blood pressure of 70 or something that the patient's hypotensive, but sometimes NCLEX gives you like a 95 over 70. And you're like, is that okay? All right. Make sure you know your normal ranges for an adult. Make sure you're not working with a young child or a teenager. And if you see 90s over 60s, 70s, consider it hypotension. Okay. Especially, all right, and it becomes shock when hypotension combines with tachycardia. So if you have a hypotensive patient who is also tachycardic, really show that algorithm that you understand this patient is heading into shock if they're not already in shock. But NCLEX isn't about patients who are squarely in a state or the other. It's about emerging and changing states for the patient. So you really have to keep your eyes out on the NCLEX for emerging crisis, critical values that are on the borderline or on the edge, right? So definitely hypotensive patient who's also tachycardic is they're trying to tell you something. They're trying to show you that this patient deserves more attention than the others, all right? Or it's trying to show you if you're just singly working with this patient that there's an emerging change in their status that you need to act upon. Okay. Now, diaphoresis is usually cardiogenic compromise, like I told you before. That could be a sign of shock. Okay. That could be a sign of emerging shock, particularly if the patient is hypoglycemic. Now, if the patient is hypoglycemic, they're already doing things that show hypoglycemia, right? What are the hypoglycemia signs? Drunk and in shock. Okay. Thanks to Mark K, we have that. Let's use that. Drunk and in shock. Those are going to be the patients who stagger, slur their speech. They're going to be ataxic, which is staggering, right? Not able to pass those field sobriety tests. They're going to be altered. They're going to be a little confused, all right? And then they'll also be hypotensive. They'll also be tachycardic. They also might have diaphoresis. So recognizing the patient that's not doing well, the patient that really needs your attention right away, will involve you understanding these subtle changes, these signs, these symptoms. All right. Now, if they have the hypotension, tachycardia, and also some creeping up or low grade fever, right? With a little elevation in the temperature, not a lot. We're not looking for 104, 103, 102, not even 101. Maybe like 99.9 over the course of a couple of days, it creeps up to 100.3, 100.5. Oh man, you're seeding a low grade fever here. You're seeding probably a little infection. And sepsis is not always like it's too late when they're 105. Not too late, but they're in the worst case then. NCLEX wants you to catch problems as they are emerging. That's what they're interested in knowing, not so much that the patient has already gone over to super crisis mode and you're recognizing a patient that's already super critically on the wrong side. Okay. So picking up on those signs and symptoms will be so key. All right. Now, another type of shock is hemorrhagic, and it's connected to the loss of blood. And usually the loss of fluid volume will result in hypotension. So again, if you know hypotension and tachycardia together make up shock, you'll catch all three. Okay. But if you include some of those other more subtle signs, you'll catch it on the ones that are connected to cardiogenic shock versus hemorrhagic shock versus hypoglycemic shock versus hypotensive shock. All right. So, you guys, this concludes the CARE Plans mnemonic. All right. The whole idea is that you consider the letters when you are studying and going through your practice questions. All right. And are you using a decent practice question bank, a reputable bank that will allow you to explore priority questions at great length? Okay. Well, there are multiple banks out there that I'm not sponsored by any of them, and I can't particularly say that I endorse one over the others. So take a look at some of these qualities of the different banks and know that there is an opportunity for you to really get a handle on the patterns and themes by digging into practice questions. So, how many do I recommend you to do throughout the course of your studying? I would say that a minimum of 2,500. Okay. You can't even detect the pattern that you will need to see in the different areas if you don't get, you know, over 2,500. And that's just my opinion regarding that. I think fewer than that, you're like cheating yourself opportunity to get a wide berth of topics covered. And you'll never get all the topics covered before you take the NCLEX. The goal is to be able to meet that threshold of 61% for NP for not NPs for LPNs, and for RNs, you need to make about a 51% pass rate on your practice questions. So 51% keeps you going, right? Will be a good predictor. Now, if both of you could land at 60% PNs and RNs, you're likely to pass the NCLEX. Okay. So continue to practice until you're holding a strong average of about 60% with your practice questions. Don't forget Nurses Labs. They have the free questions if you want to double up or have more questions, because honestly, if you pick one bank, only one bank to be in, you will learn that one bank, right? And there's no one bank that's superior to all the other banks. They're all pretty helpful in their different ways, right? So definitely, if you haven't chosen a bank where you're going to get 2,500 plus questions, then you need to, and the free one is there if cost is an issue.